Now to talk about improvements when it comes to medical treatment with USA Health. Today, a look at ultrasound technology and how it's helping doctors, specifically in the ER. So we have Dr. Timothy Bo-Stokes in the studio from USA Health to talk more about ultrasounds. And most people may think when it comes to the ER, x-rays, CT scans, but ultrasounds are important too.
Yes, so x-rays and CT scans have radiation risk with them, and what we found is as you age, the more radiation you've been exposed to through x-rays and CT scans. If you get them too frequently, you have a risk of cancer down the line. So ultrasound only uses sound waves. There's no radiation exposure. And so what we've tried to do is replace as safely as we can those CTs and x-rays with ultrasound whenever we can in the emergency room.
So what kind of well, how could you use an ultrasound compared to not using an x-ray?
So in the emergency room, we've tried to apply it to a lot of different organs and complaints that patients have. So for instance, if you're in a car accident, depending on how severe it is, you still might end up getting a CAT scan, but we can look for bleeding with an ultrasound. If you have belly pain, we can look for gallstones or kidney stones. If you're having chest pain, we can look for blood clots in the lungs or signs of a heart attack on the ultrasound. So really, we can apply it to a lot of different scenarios.
Wow, okay, so and this was really cool to me because I love tech and I love health as well. So this is an ultrasound device, and I've got it plugged up to my cell phone.
So what they've done,
cool.
What companies have done is they've taken the whole machine and they've changed it into a computer chip instead of some of the other technology that they were using in the past, and we've been able to get similar technology into one little probe like that instead of the big machine. It's not as good of a picture quality as you might get with a big machine, but it's still, as you can imagine, in scenarios where you can't have a big machine, we can now have ultrasound. So in the helicopters, in the ambulances, in a rural emergency department that doesn't have a budget, in a medical school that doesn't have a machine for every student. So the technology in this little probe has allowed us to apply it to a lot of other scenarios that we wouldn't have been able to in the past.
So I asked you when I plugged it up to my smartphone if it was going to actually function as an ultrasound, and you said no.
No.
I don't have the software.
Yeah, we have special HIPAA compliance software, so that way all your patient data is stored the correct way, and only people that are authorized to use it can use it.
What other kind of advances are we seeing in terms of ultrasound? I mean, because it really will make a huge difference when you're able to pinpoint something sooner, you can fix it sooner.
Yeah, so for instance, when we have patients who have low blood pressure or are very, very sick, we can decide if we're going to use fluids or not, or what treatment medications we need to use depending on what we see in real time at the bedside with the ultrasound. Where in the past we might have had to use more educated guesses or wait for a CAT scan or x-ray to come back, which could take an hour or two sometimes. This is happening as I talk to you, as I examine you in real time.
Oh my goodness, okay.
Yeah.
Wow.
So I'm at your bedside with the probe in my hand as we're talking and right as you present.
Awesome. Well, thank you so much for stopping by and sharing some of this with us. Out of curiosity, what are you seeing most in the ER right now? Oh,
we see a lot of stuff. We have a lot of traumas because it's summer now.
Yeah.
Be careful with COVID, obviously. The rates are rising again, and especially in our children's ER, we're seeing a lot of respiratory viruses like RSV and flu. I think because as our masks have come off, now we are more exposed to those typical viruses we'd only see in the winter, but we're seeing a big resurgence of those.
Well, we appreciate the work that you guys are doing over there. Thank you.
Yeah, thank you.
And we'll be sure to have this posted to our YouTube page and our website as well, so that way you can watch it and share it with someone you know. Dr. Stokes, thank you.
Thank you.